The CDC just relaxed its COVID guidelines, dropping the recommendations on quarantining and testing. Let's talk about it. Hey, everybody, it's Dr. David. Now, this is pretty big news considering where most of us have been living our lives and trying to square that with what the federal guidelines are in terms of COVID. And we've known for a long time that it seems as if the federal guidelines would lag behind what most people were doing. And of course, I understand that the CDC is going to have a much more slower and methodical and um, more overcovering effect than a person would be on a one-to-one basis or when talking to a physician or somebody else. But I am really thankful that they've issued these guidelines. We've most of us have moved into this living with COVID phase as opposed to hiding from COVID phase, right? We now know because so many people are immune. It's now estimated that 95% of Americans over 18 are actually have immunity, whether it's from vaccine or from previous disease, and of course the hybrid immunity that we've talked about. And so the CDC does seem to be reflecting changes based upon these types of current realities. Now, it is important to know that the previous guidelines, um, we know what they were before, right? And again, I realize so many people felt that they were overbearing, too oppressive, etc. So let's break down what they are now saying. Okay. Now, first of all, in terms of people testing positive. So this is the one area that's actually not changed too much because these are people who actually have COVID. Okay. And they continue to say that if a person has tested positive, they should be isolated for at least 5 days, regardless of whether they've been vaccinated or not. Okay, so that means everybody, if you test positive, you should be isolated. People then, after the 5 days, can end their isolation if they've been fever free for 24 hours without needing any fever reducing medications and their symptoms are improving. Now, it is recommended that the people, when they leave the house for the next 5 days, that they still wear a mask to stop the spread to other people, which makes sense because we know that many people still are contagious 5 days later. Now, also the definition of what they're considering negative when it comes to rapid testing. So, it previously the FDA was actually saying that you would take two rapid antigen tests over 3 days, and if you had two negative, then you were considered okay and negative to the disease. Now they are recommending three tests that are negative. I think this does make sense because we know that while a positive test clearly picks up the virus, there are times where there are false negatives when it comes to COVID testing, especially of the rapid test. So I agree. The more tests that one does to prove that they're negative, and if it's over that same period of time of the 3 days, you'll catch more people. You catch more people that can stay in that should be in quarantine and not exposing other people unknowingly. Okay. So now what about known exposures? And this is one of the bigger changes. So now they say if somebody has a known exposure to someone who is COVID positive, but that person is not showing any symptoms, it is no longer necessary for the exposed person, not the infected person, but the exposed person no longer has to be quarantined at home. Although it does urge people that if they have been exposed, if they have a known exposure to somebody, it is recommended to wear a high quality mask for 10 days and get tested after 5 days just to see if the person has it. So that is a big change. I realize there are people who aren't going to wear masks, but to me, a person who has a potential infection to others, that is the person who is most relevant for them to be wearing a mask, even if they're not perfect. And of course, the quality of the mask, as we've talked numerable times, does make a difference. So basically, another way of thinking about it, if you've been in close contact with somebody who is infected, you no longer have to quarantine, only quarantine if you are infected. Okay. Now, physical distancing. Now, I realize that, and as you heard me speak very early on, well, I chose to use the word physical distancing as opposed to social distancing because I thought that we should be socially connecting with people and just physically distancing when it was really warranted. They're dropped it altogether. No longer do people need to be 6 feet apart at all times of the day, and we're in public, private. The little stickers that we see on the floors in supermarkets and signs all over the place, those are now completely by the wayside. I think it's probably makes sense because first of all, the virus would spread more than 6 feet, and of course, now that all these people do have some level of immunity, it's just not as dangerous for them if they were to catch it. Of course, most people don't want to catch it, but there is that reality. Now, of course, if you are in contact with somebody who has the virus, of course you have a better chance of catching it. And of course, how one's immune system, their status is in terms of whether they will catch it or not, obviously depends on prior immunity. And of course, vitamin D and zinc. Yay, right? Got to talk about that. Okay, now here's the other thing, school testing. This has been a change also. It is no longer recommended that schools of any type do routine testing. Now, there were some schools who were doing testing weekly, doing testing daily. CDC says that is not necessary. Now, also, there was this test to stay approach where if you were exposed to somebody, you could go to school as long as you were testing negative each day. But now they're saying we shouldn't be testing at all. So of course, test to stay doesn't make any sense. And of course, if people don't have to be quarantined just because they've been exposed, then this test to stay in school doesn't make a lot of sense either. So now if a student has a known exposure, the CDC is just saying they don't need to be in schools, but unless they're symptomatic. And of course, if you're symptomatic, you should be testing. Again, that three tests does make the most sense. Of course, if your kid's sick, don't send your kid to school, right? We knew that from before, whether that was with flus or any cold symptoms. If your kid's sick, don't send your kid to school. So we're kind of now seeing COVID getting more into that realm of the way we would be treating influenza or other common colds. Now, what about masks? Of course, the most controversial concept of all of this. They are saying that masks should continue to be worn only and they say the word recommended, only in areas where community transmission is deemed high or if a person is deemed high risk of severe illness. So, of course, if you are a person who is at high risk and you are potentially going to be exposed to people, how you protect yourself. And we know that those KN95 and the N95s are superior for sure to the cloth masks and certainly are better than the surgical types of hospital masks as well. Now, of course, there could be some local requirements for local health agencies where they still have things on the books or they haven't changed it or won't change it. And of course, if there is a local law, a person may have to abide by that if there is some legal legal repercussions. And of course, it will be rather interesting to see how all of this is going to play out over the next couple of months when policy meets reality again. All right, so thank you for listening. Of course, please subscribe to our channel, share it with others, hit the notification button if you want to be notified whenever we put out gems like this. Have a great day.